Well, can you imagine what would happen if the promises of artificial intelligence and actually more important, augmented human intelligence, if they really pan out the way we would expect them to? I mean, for the caregivers, there would be an important change in the quality of their job. And for the caregiving institution, like a hospital or a clinic, there would be important differences in the way in which they actually organize their staff to care for our patients. And of course, for the patients, it's got to get better. Let's think for a moment about the caregivers. Those caregivers, thinking about these patients who are potentially at risk, and how do they do it today? Well, they've got numbers that are coming from the electronic health record, and they've got another set of numbers that are coming out of the lab, and they've got images that are coming from radiology, and they've got all this information. They've got to mix it together with what they're hearing from the family and from the patient, and they're doing all that, and then multiply that by 10 patients or more patients, depending on where you're working and what time of the day it is. And the ability of our caregivers to do all of that requires superhuman effort. And then to do it with the interruptions that we have in healthcare and the documentation requirements, after a while it becomes not only a big intellectual burden, it becomes a big emotional burden. These people go home tired. What if we could have the computers, what if we could have these systems start to aggregate the patient information, get you to really good patient summaries, so that then they can start to act at the top of their license. They can start to do the things that require the most systemic thinking around biology. Wouldn't the quality of their jobs would go up? The quality of their decisions, you would think, would go up as well. And of course, if now you're an institution and you hire a bunch of people like this, imagine the productivity would go up. Imagine the patient satisfaction surveys that come back, because the caregivers are not only making good decisions, they're also doing it with compassion and with care, because they're allowed to actually engage with the patient at a very, very high level of engagement. And of course, the patients. It would be just almost game-changing in a way to know that your caregiver is not just thinking about you as another step in a process, but has all of the information they need when they need it, so they can pause long enough to think about it. So the peculiar ways in which you might express the disease, or I might express the disease, can be attended to out of a personalized form of healthcare that's very, very hard to do.